Why do we need to talk about mental health and autism? How can people receive an autism and mental health diagnosis in British Columbia? Welcome to Autism Q and A. My name is Jake Anthony. Mental health conditions are not exclusive to the autism spectrum. However, many autistic children, youth, and adults like me do experience co-occurring mental health diagnoses such as depression, anxiety, ADHD, ADD, obsessive compulsive disorder, and others. So how can people receive an autism and mental health diagnosis in British Columbia? Many people can receive both their mental health diagnosis with their autism diagnosis. So in BC, it's typically through counseling that a recommendation for an assessment happens. And it's often the psychiatrist who recognizes that there's more going on than a mental health condition, sees autistic traits in a patient. So when I was at the Sunny Hill Hospital child psychiatric team who diagnosed me back in 1997, they saw my autistic traits as well as a few other co-occurring conditions around mental health and gave me both an autism as well as mental health diagnosis. What do you do when you receive a diagnosis? Mental health and autism therapy options can and should be based on individual needs. I would recommend working closely with your family doctor, pediatrician, psychologist, psychiatrist, and counselor, and reach out to provincially available government as well as nonprofit resource providers. Let me introduce a few provincial nonprofit resources here. One is the Crisis Line Association of BC. Speaking with a trained crisis line worker can make a significant difference in people's lives. Crisis line workers are trained in critical thinking skills to respond to calls involving a wide array of concerns, from homelessness, mental health, substance use, poverty, abuse, and suicide. You can visit their website for local crisis line numbers at www.crisislines.bc.ca. If you are considering suicide or if you're concerned about someone who may be, call 1-800-SUICIDE. For emotional support, information, and resources specific to mental health, you can call 310 Mental Health Support at 310-6789. As the pandemic continues, many of us are feeling the effects on our mental health. The BC COVID-19 Mental Health Network provides province-wide access to free phone-based and short-term support with a counselor. You can reach them by email at bccovidtherapist@gmail.com to receive an appointment time. If you're a parent or caregiver, BC Children's has two great resources for you to support your children and youth's mental health. Check out Kelty Mental Health Resources Center at keltymentalhealth.ca and as well as Compass Mental Health Center at compassbc.ca. These help to provide information, toolkits, and parent-peer support to any mental health concerns that you may have related to your child or youth. You can connect with a parent in residence from Family Smart. They also support parents, caregivers of children and youth dealing with mental health challenges. Contact them at info@familysmart.ca, or you can contact them by phone at 1-855-887-8004. If you're a young person watching this video, visit the Foundry at foundrybc.ca for a one-stop shop to access mental health care, substance use service, and more. The pandemic has affected all of our mental well-being, whether or not you have a pre-existing mental health condition. At this time more than ever, we need to support one another and to make sure to practice self-care. Get out for a nice walk, make sure that you're getting enough sleep, and I can tell you from personal experience, don't bottle up your emotions and what you're struggling with. And if you don't feel comfortable talking with a therapist or a clinician, take the time to talk to a close friend or a family member, whether that's virtually on Zooms or on the phone. But whatever you do, just stay connected. Please visit our website and blog for more resources on mental health at www.autismbc.ca/blog.